Greetings, distinguished ladies and gentlemen. My name is Sulaiman Lakoh from the Ministry of Health and Sanitation of Sierra Leone. Pleasure to talk to you about an assessment we conducted, which shows that there are gaps on hand hygiene implementation in 13 of the public hospitals in the western area of Sierra Leone. Certainly, there is a problem. There's a problem because we are losing people. And we are losing them because they acquire infections in the very places they should be healed. And when that happens, they stay longer in our hospitals and incur more cost to service their healthcare delivery. The underlying problem for all this is because hand hygiene is suboptimal in many of our hospitals. We measure this by assessing hand hygiene practices and promotion across the 13 public hospitals of the western area of Sierra Leone. And this we did in May 2021. We did this by using an observational tool developed by the World Health Organization to collect information from infection prevention and control focal persons. These are people that provide leadership on infection prevention and control in the respective hospitals where the assessment was conducted. We realized that there is no plan to improve hand hygiene infrastructure in all of the hospitals that we assessed. Again, none of the hospitals had a dedicated hand hygiene budget to actually support hand hygiene promotion services. None of the hospitals have a systematic audit of the presence of hand hygiene resources, such as alcohol-based hand rub, such as soap, or hand hygiene resources that are used for hand hygiene promotion, like job aids, guidelines, etc. Formalized patient engagement program was available in only 3 hospitals, despite the fact that patient engagement has been shown to improve patient involvement, as well as awareness of hand hygiene among patients, their caregivers, and communities. Our result has shown that we can do something to prevent unnecessary death and excess costs incurred by our patients in our hospitals if we do one thing, and that is to improve hand hygiene. If we fail to act now, we will disturb the implementation of hand hygiene activities, and we will not be able to properly manage our hand hygiene resources. In the short term, we recommend to put systems in place to engage all stakeholders to prioritize hand hygiene. In the long term, we need to have a costed plan with required resources set aside to support hand hygiene activities. I will leave you with this message to say hand hygiene practices and promotion in our public hospitals are suboptimal. We must act now to prioritize hand hygiene activities in order to prevent the spread of infections in our hospitals. Thank you very much.